And here to help us unpack all of this is Dr. Jean Kaseya. He's Director General of the Africa Centers for Disease Control and Prevention. Dr. Kaseya, thank you so much for joining us.
Thank you so much for having me.
Of course, Doctor, I'm curious, I'm wondering if you can update our viewers around the world on what the U.S., or at least from your perspective, the U.S. CDC now says that efforts are currently underway to relocate a small number of Americans affected by the outbreak in Africa. Is there any light that from your end that you might be able to shed, perhaps if they were exposed to this?
Let me first say that today, Africa and African leaders are so proud of the Africa CDC because on the 15th of May, once I got clear information from DRC and from Uganda, Africa CDC was the first one to declare this outbreak. And from there, from day zero, we started to support countries. And I called for a meeting with all partners on the 16th of May. A US CDC represented by the Global Health Security was attending this meeting and all other partners. Today, Africa is increasing the response to this outbreak, but we cannot accept to not have vaccine and medicine available while the science to make it is ready. And we need to have this approach to support Africa to have medicines and vaccines because we can do that.
Bearing all that in mind, Dr. Kaseya, what are the biggest concerns that you have right now when it comes to containing this outbreak?
The biggest concern first, as I said, we cannot contain an outbreak without tools like vaccines and medicines. But the second one, we are now working to increase the communication aspect. Communication vis-a-vis our communities, because we know that funerals are also main drivers of the spread of this outbreak. We are also supporting our health workers by providing the protection measures to health workers. Yeah. But overall, we are increasing, the coordination aspect, knowing that we are in a time of resources that are constrained, and we need to have a strong coordination mechanism. This is why I decided to stop my engagement in Geneva. I'm going back today to Africa to coordinate with ministers this response.
No, that's important. Is if you, at this point, if health officials can't combat this with a vaccine, they can at least do so with information, as you point out. What can you tell us about this particular strain of Ebola and what makes it so difficult to detect?
Bundibugyo is the third outbreak that we're experiencing in Africa. We know very well the Zaire strain, but Bundibugyo started in 2007, 2008 in Bundibugyo district in Uganda, and we had the second one in Isiro in the northern part of DRC. This is the third one, but what we are seeing with the current outbreak, it's more virulent than others. It's more deadly than the two other outbreaks that we had. And now we are conducting studies to understand why this outbreak, currently this virus is killing more than others. Is there any factor that can explain that? We also know that we are in a region where there is insecurity. We have density of population, and we have population moving from an area to another one, from Ituri to Uganda, from Ituri to South Sudan, now from Ituri to Goma, as we know that there is now a confirmed case in Goma. This is what is making this outbreak more concern for us.
Dr. Kaseya, I have less than a minute with you. I'm curious if you could just close on what your message is to healthcare officials that really around the world, especially with the summer bringing now increased travel. Of course, many people expect to travel for the FIFA World Cup. What should the international health community be focusing right now, especially when it comes to potentially even expediting efforts to screen for this?
We need to increase the screening capacity. As I was talking with the minister of Rwanda yesterday, he was telling me DG, what we need is to increase our capacity for diagnostics. We have the ability to do that in Africa and with Africa CDC and other partners. We are not recommending other measures because we need to open borders, we need people to fly, but what we need is to make sure that we are screening each person, we are isolating those who are at risk, and we are taking all public health measures that can protect all of us. I think for now, we are on top of things. We are leading the response. And if we have appropriate support from our member states, mostly in terms of funding, but also from our partners, we can rapidly stop this outbreak.
Yeah, so many people turning to Africa, looking to Africa CDC for ways to resolve this. Dr. Kaseya, thank you so much for your time, as always.
Thank you.